ako po pala si Mayon Almaty, ang clinical pharmacist for today. So, daily monitoring lang po and verification ng ating medical records para po mas makapagbigay pa tayo ng more information about your clinical condition and also to give you some advices and kung ano po ang treatment plan natin for your fast recovery. Is that okay, ma'am? So, upon checking po your medical records, ma'am, sadly, pasok po tayo sa criteria ng stroke patients. So, do you have any idea about stroke po? Okay, so ang stroke ay...
Stroke is a disease that affects the arteries leading to and within the brain. It is the number 5 cause of death and the leading cause of disability in United States. A stroke, sometimes called brain attack, occurs when something blocks blood supply to a part of the brain or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or even death. To understand stroke, it helps to understand the brain. The brain controls our movements, stores our memories, and is the source of our thoughts, emotions, and language. The brain also controls many functions of the body, like breathing and digestion. To work properly, your brain needs oxygen. Although your brain makes up only 2% of your body weight, it uses 20% of the oxygen you breathe. Your arteries deliver oxygen-rich blood to all your parts of the brain. If a stroke occurs and blood flow can't reach the region that controls a particular body function, that part of the body won't work as it should. If the stroke occurs toward the back of the brain, for instance, it's likely that some disability involving vision will result. The effects of a stroke depend primarily on the location of the obstruction and the extent of the brain tissue affected. The effects of a stroke depend on several factors, including the location of the obstruction and how much brain tissue is affected. However, because one side of the brain controls the opposite side of the body, a stroke affecting one side will result in neurological complications on the side of the body it affects.
Pathophysiology of stroke. A stroke occurs when the blood flow to an area of the brain is interrupted, resulting in some degree of permanent neurological damage. The two major categories of stroke are ischemic stroke and hemorrhagic stroke. Pathophysiology of ischemic stroke. The common pathway of ischemic stroke is lack of sufficient blood flow to perfuse cerebral tissue due to narrowed or blocked arteries leading to or within the brain. Ischemic strokes can be broadly subdivided into thrombotic and embolic strokes. Narrowing is commonly the result of atherosclerosis, the occurrence of fatty plaques lining the blood vessels. As the plaques grow in size, the blood vessels become narrowed and the blood flow to the area beyond is reduced. Damaged areas of an atherosclerotic plaque can cause a blood clot to form, which blocks the blood vessel, a thrombotic stroke. In an embolic stroke, blood clots or debris from elsewhere in the body, typically the heart valves, travel through a circulatory and block narrower blood vessels. Based on the etiology of ischemic stroke, a more accurate subclassification is generally used. Large artery disease. Atherosclerosis of large vessels, including the internal carotid artery, vertebral artery, basilar artery, and other major branches of the circle of Willis. Small vessels disease. Changes due to chronic disease such as diabetes, hypertension, hyperlipidemia, and smoking that lead decreased compliance of the arterial walls and or narrowing and occlusion of the lumen of smaller vessels. Embolic stroke. The most common cause of an embolic stroke is atrial fibrillation. Stroke of determined etiology such as inherited diseases, metabolic disorders, and coagulopathies. Stroke of undetermined etiology after exclusion of all of the above. In the core area of stroke, blood flow is drastically reduced that cells usually cannot recover and subsequently undergo cellular death. Pathophysiology of hemorrhagic stroke. Hemorrhagic strokes are due to the rupture of blood vessels leading to compression of brain tissue from an expanding hematoma. This can distort and injure tissue. In addition, the pressure may lead to a loss of blood supply to affected tissue with resulting infarction, and the blood released by brain hemorrhage appears to have direct toxic effects on the brain tissue and vasculature. Intracerebral hemorrhage, caused by rupture of a blood vessel and accumulation of blood within the brain. This is commonly the result of blood vessel damage from chronic hypertension, vascular malformations, or the use of medications associated with increased bleeding rates such as anticoagulants, thrombolytics, and antiplatelet agents. Subarachnoid hemorrhage is the gradual collection of blood in the subarachnoid space of the brain dura, typically caused by trauma to the head or rupture of the cerebral aneurysm.
Okay ma'am, so ano pong other symptoms natin na na-experience before po tayo na-admit? Na-experience nyo pa rin until now. Ano nga ba ang other clinical presentations ng stroke?
Clinical presentation. So in general, the patient may not be able to reliably report the history due to cognitive or language deficits. The signs and symptoms of stroke include severe headache, vision changes, dizziness, difficulty understanding, lack of balance, trouble walking, numbness, confusion, trouble speaking, or the inability to communicate, and lastly, weakness. For the weakness, there are two types, the hemiparesis and the monoparesis. Hemiparesis is the weakness of one entire side of the body, and the monoparesis is the muscle weakness that affects one limb, such as a leg or an arm. For the laboratory tests, in acute stroke, assessment of blood glucose, platelet count, and coagulation parameters such as prothrombin time and APTT are used to determine treatment eligibility. Other diagnostic tests include CT scan of the head, which will reveal an area of hyperintensity in patients with hemorrhage and will be normal or hypointense in patients with infarction. Next is MRI of the head, which will reveal areas of ischemia with higher resolution, and an MRI with diffusion-weighted imaging, which will reveal an evolving infarct within minutes of stroke onset. Next is vascular imaging with CTA, or our computed tomography angiography, which is recommended in patients with endovascular treatment indications. Next is an ECG. It can help determine whether the patient is presenting in atrial fibrillation. Next is TTE, or the transthoracic echocardiogram. It can identify cardiac valve abnormalities or wall motion abnormalities as sources of emboli to the brain. In patients unable to undergo CTA, Carotid Doppler and transcranial Doppler can be used to determine extracranial carotid artery stenosis and intracranial artery stenosis.
So here are some of our medical treatment plans for stroke patients.
We're gonna discuss the treatment for stroke. In here, we're gonna cover the desired outcome, general approach to treatment, non-pharmacologic and pharmacologic treatment. For the desired outcome, we have here the goals of treatment of acute stroke, and these are to reduce the ongoing neurologic injury in the acute setting to reduce mortality and long-term disability. The second one is to prevent complications secondary to immobility and neurologic dysfunction. And the third one is to prevent stroke recurrence. And we also have here the major causes of stroke recurrence. This includes hypertension, atrial fibrillation, and heart disease. General approach to treatment. We have to ensure adequate respiratory and cardiac support and determine quickly from CT scan whether the lesion is ischemic or hemorrhagic. Evaluate ischemic stroke patients presenting within hours of symptoms onset for a perfusion therapy. Elevated blood pressure should remain untreated in the acute period, or first 7 days after ischemic stroke to avoid decreasing cerebral blood flow and worsening symptoms. Blood pressure should be lowered if it exceeds 220 over 120 mm mercury or there is evidence of aortic dissection, acute myocardial infarction, pulmonary edema, or hypertensive encephalopathy. If blood pressure is treated, short-acting parenteral agents, for example, labetalol and nicardipine are preferred. Assess patients with hemorrhagic stroke to determine whether they are candidate for surgical intervention. After the hyperacute phase, focus on preventing progressive deficits, minimizing complications, and instituting secondary prevention strategies.
Non-pharmacologic treatment as acute ischemic stroke, endovascular thrombectomy with a stent retriever, surgical depression, and interprofessional team. For secondary prevention, carotid endarterectomy. Carotid endarterectomy is a surgery that removes plaque buildup from inside a carotid artery in your neck. And the second one is stenting. Stenting is when you use a stent, which is a tiny tube that your doctor can insert into a block passageway to keep it open. The stent then restores the flow of blood or other fluids depending on where it is placed. Stents are made of either metal or plastic. For the pharmacologic treatment for ischemic stroke, there is alteplase or aspirin 160 to 325 mg per day. For the secondary prevention, you could also have antiplatelet therapy or oral anticoagulation with vitamin K antagonist, which is warfarin, and also apixaban, dabigatran, or rivaroxaban.
Thank you so much, Ma'am, for all your help and for explaining me my medical situation. I will try
Very much welcome, ma'am. So we're hoping for your fast recovery soon. Thank you for being very cooperative patient.